Good morning, everybody. So I was super excited about this week, just because this is something that is really super interesting to me. Just the world of concussions, a little bit of sports psychology, stuff like that. And so wanted to have one of Sanford's doctors on, Doctor, right?
Yeah.
Awesome. Kate Higgins. So talk to me a little bit first, because we were talking about it off air, just a little bit about neuropsychology.
Yes.
Right. All right.
Yes.
So to the lay person, talk to me about that a little bit.
Okay. So my doctorate is in clinical psychology. So I have a lot of the sort of traditional therapy, sit on the couch and talk about your feelings training.
Sure.
And then on top of that, I have extra training and then a fellowship in neuropsychology, which is essentially how the brain and our emotions or our sort of internal experience interact to create all of the behavior that we see on a daily basis. So a lot of things like neuropathology and behavioral neurology and things along those lines on top of the clinical psychology degree.
Awesome. Yeah. So I think what I'd like to talk about today is a lot about concussions and things like that with combat sports for one, and then just sports in general. Mm-hmm. And then from there, maybe a little bit of the sports psychology thing. But like you said before, you'd rather just keep it as not call yourself a sports psychologist, obviously, but maybe delve into a little bit of that anyway. So
yeah, absolutely.
Awesome. So what got you interested in all this stuff? I mean, it sounds like beforehand that you're an athlete. Obviously, it looks like you're going to be doing some longer runs.
Yes,
so that's
hopefully.
Yeah, talk to me about that too. So,
I grew up in a sports family. I have siblings that play sports, and when I got into school, the brain is just such a fascinating thing.
For sure.
There's so much we don't know about it, and then when you add in, our emotions and our environment, it becomes an even more complex thing because everything interacts. The brain doesn't sit in a vacuum, and our emotions and our environment don't function independently. It all works together. So no two people are alike because that's different for every single person. So pretty early on, I was fascinated by that. What was really interesting was when it goes wrong. Because again, that looks really different depending on the injury to the brain. I work with a lot of kiddos. So then we've got, the family environment that plays a huge role in how somebody responds and recovers from, say, a brain injury. So just the difference, it's just the sort of thing where I feel like I could literally learn something new every day and retire in, well, hopefully not 75 years, but retire in a long time and still not have learned everything there is to know.
Right. Yeah, that's it. It's super interesting. That's probably the main reason why I got into the world of martial arts, is that it's every day I'm learning something completely new, and it's just, as much as you think you know, all of a sudden you realize how little you know. So I guess we'll start this off with the concussion side of things. What got you into that portion? Just the idea that the injuries are there, or?
So actually, back when I was trying to put together a dissertation, which, is this horrendous project that they make you do in order to get your degree, I was really interested in brain injury in a military population.
Okay.
But studying in a military population when you don't already have an in is really, really challenging. At the same time that I was working on this project, I was taking a class in sports psychology, which I also found really interesting, partly because of my own personal history, but just to see sort of a different application of some of the basic things that we learn in a clinical psychology program. And I sort of had this epiphany one day of, I can put these two things together. I didn't see a great way to break into the military population to study brain injuries, but that was happening in this sporting population. And so that's kind of how my dissertation came together. And then I ended up being able to do some training rotations with that population. And the more I did it, the more I liked it. And so now I'm here, and that's really probably a good 50 to 60% of what I see as far as my patient load.
Sure. And I guess talk to me a little bit about your, has it been pretty much all distance running, or have you done other sports, things like that? I guess we should take that back a little bit and say, so it sounds like you have maybe a background in sports. So
yeah, I played soccer up through college, and then realized that I was going to have to find something else to do, or I was going to weigh 500 pounds because when you're a soccer player, you really can kind of eat whatever you want because
Right.
you work out pretty heavily. And my mom is a runner, so picked up running and caught the bug. Did my first half marathon about 10 years ago and was like, this is awesome. When I crossed the finish line, I was like, this is awesome. Before that, I sort of questioned some of my decisions, but
Sure.
got the bug and now, do races pretty regularly. So
Yeah. And for me, I'm by far not a long distance runner, but for me, that's almost all mental and I mean, obviously physical too, but I think way more of a mental sport than most people would think about. And so that's probably part of, it probably helped you a little bit, I'm guessing, with some of your background.
yeah. And again, I would not call myself a sports psychologist. I don't have the appropriate training to do that. That being said, I know enough probably to be dangerous. But one of the reasons I love running is for the mental health benefits.
Mm-hmm.
Days at the hospital can be stressful, and I love my hour or sometimes a little longer in the morning where it's quiet and it's dark and I'm by myself and I can almost just like feel the stress bleed off me, and I can tell a difference on the days when I run versus when I don't. So the mental health benefits of running for me are, in some cases, probably outweigh the physical benefits at this point.
For sure.
So,
and so on this concussion side, you said that's about half your workload. It seems like. Where are you seeing most of these in regards to sports? Is it, soccer players, football, basketball, boxing, whatever?
that's really seasonally based.
Sure.
I mean, so obviously in the fall it's football, and that's an overwhelming majority of what we see in the fall. A lot of hockey. So I'm new to the Sioux Falls area. I moved up here in October.
Yeah, you moved from Missouri, right?
Moved from Nebraska. I did
Okay.
fellowship in Nebraska, and so I'm learning hockey.
Sure.
Nobody
Yeah.
really plays hockey in
Yeah.
Nebraska, at least where I'm from.
I lived in Nebraska too, so that's
Okay.
Okay. Yeah, it's also it's basically football. So.
Yes. And then hockey, we've honestly, and this isn't sport, we've had a lot of car accidents recently, which I think probably is ice,
Mm-hmm.
And I haven't been in Sioux Falls for a summer season, so I'm not for sure what we'll see. It may be more of like the bike accidents, playground accidents, people just being outside and doing outdoor things that increase their risk of hitting their head.
Sure. And so from my understanding, concussions and things like that come not from like the initial impact, but then the reverberation. Is that, am I incorrect there? Or would you say it also could come from like that first impact?
Yeah. I guess I would say
I'm dumbing it down a little bit. I realize that.
I would say both. So the old idea with concussion is that it happens, like when your head runs into something, and so your brain bangs forward and bangs backwards, and you get the damage, if you will, from the brain running into the skull.
See, that's my old way of thought. All right,
Okay.
go on.
Okay.
Great.
So we're sort of we're thinking that's not completely accurate.
Okay.
One, because things like whiplash can actually cause a concussion where there isn't any physical impact to the head. The other thing is that, well, at least with this old idea of the brain banging forwards and backwards, we would talk about a coup and a contra coup injury, which is like bruising on the brain where it ran into the skull. We're moving away from that idea because any sort of bruising on the brain is going to show up on a CT or an MRI.
Mm-hmm.
And one of the hallmarks of concussion is that imaging is clean.
Can't see it.
Right.
Right.
Nothing shows up. So that's why we're sort of moving away from that idea. There's also new research coming out. One of the articles that I read recently, they had put sensors not in like mouth guards in the front, but in mouth guards that were in the back of people's mouth
Sure.
to measure forces on the head. And then they were trying to take that information and come up with a computer simulation of what was happening in the brain. And this computer simulation showed that the greatest strains are actually in the white matter tracts. So everything in the brain is connected. The white matter are those long wires that connect the different parts of the brain. And that's what's showing the greatest strain. So it's not bruising on the surface. It's stretching and tweaking, I guess, if you will, for lack of a better word, of those long wires that connect the different parts of the brain that actually show the greatest change after a concussion.
Sure. And so like the white matter connects to the gray matter?
Yes.
Is that, all right.
Yes.
Sweet.
Yes.
Okay. So I'm going to start. Now I'm going to have to research all this stuff. I should have done that beforehand. All right. So the protocol for you as a doctor, I guess, what would you normally say? A person gets their first concussion.
Mm-hmm.
How long would you say that they should be out, and some of the aftercare that when that happens?
Yeah. So a lot is changing in the world of concussion management. So we used to do the 2 weeks, like you're out for 2 weeks regardless. We're realizing that just doesn't work for anybody. A lot of people get better faster. A lot of people get better slower. So we're really pushing to move away from any sort of like set time. So aftercare, some of the things, for the first, kind of depending on the injury, 24 to 48 hours after an injury, lots of times people do just need to do the like quiet dark room, no stimulation, skipping work, skipping school, because they feel terrible.
Right.
After that, though, one of the other recent changes in concussion management is we're moving away from cocoon therapy, which is keeping them in that dark room until they feel better. Because we're realizing that pulling people out of their life makes people depressed and anxious.
Sure. Yeah. That makes sense.
Yes. And so now, after that 24 to 48 hours, once they start to feel a little better, what I am telling people is get back into your life gradually. So if it's school, let's get you to school, but maybe you need breaks. We're not going to have you do any tests or any major projects, but just be, butt in the seat so that you're at least getting some of the information. Work, can be a little bit more challenging depending on what the person's work is, but gradually reintroducing life, more of an active rehab model as opposed to cocoon therapy, which is what we called that 2 weeks in a dark room.
Sure.
And then as far as like, when is somebody ready to get back into their sport? So I would differentiate that from exercise. I have people starting on light exercise pretty quickly after their injury. Again, sometimes 48 hours afterwards, I'm saying, I want you to take a walk around the block. Nothing strenuous necessarily, but just up and moving, get your blood moving. You'll feel better. You'll sleep better. So it's important to differentiate exercise from return to play, because exercise starts a lot sooner, but no contact. So some of the things I'm looking for that would indicate that a person is ready to start a return to play progression. So symptoms are mostly resolved back to baseline. Because some people have headaches before their concussion. Concussion isn't going to cure them of those headaches. So I want them to be back to baseline.
Right.
So we have several different types of objective testing that we do in clinic, and I want to see all of those normalizing, hopefully mostly back to normal. If it's a kid in school, I want them to be pretty much fully back into school. My priority for a student is that they be a student first and an athlete second. So I have a hard time justifying sending them back to their sport if they're still missing half days of school, or if they're way behind on schoolwork or something like that. Those are like the primary things that I'm looking for to say, okay, I think you're ready to start back into start a return to play progression.
What are some of those testings that you would do? What do some of those look like?
So in clinic, the things that we look at are eye functioning. So how quickly and effectively eye movements are working, vestibular function, balance, and then we use impact for our neurocognitive screener. And then we do symptoms as well.
Okay. Have you seen some of the changes in sport that have, like, okay, now the football players, they have different helmets, and that's supposed to help, things like that. And it's weird because, as a boxing coach, for the longest time, we used to wear headgear, which now I think the amateur side of the things, they still wear headgear. But on the Olympic side, I don't think they wore headgear this year. Part of it because that, at least in my readings, they're finding that, and we haven't actually wore headgear for a long time, just because the idea of, it's almost worse having the headgear, at least for boxing, than not wearing it, because when you have a headgear on, things like that, you tend to throw a lot harder. And then it's not really impacting, or like I said, this, I could be completely wrong with this, but I'm running with this. So if it is incorrect, you should set me straight.
Okay.
So, all right, give me your thoughts on that.
So, I mean, with the helmet thing, there's been some research that says that rugby has lower rates of concussion than football. And one of the thoughts is, like, is it because they have better tackling technique, and they don't wear helmets, so they're much less likely to drop their head.
Right. You're,
So that would sort of support the idea of headgear. Helmets actually make people more willing to put their head in harm's way.
right.
So soccer headgear is one thing parents particularly ask about. At this point, the research doesn't suggest that it changes the incidence of concussion. And I guess that's kind of what I go back to when people ask me about equipment, is what does the research say? And is the research being done by anybody other than the company producing it? Because
Sure, yeah.
I have a hard time.
Yeah.
It may be accurate, but it needs to be replicated independently. And at this point, the research suggests, I think some of the changes to play in football, like changing the kickoff line and things like that, have improved concussion rates, but a lot of the other stuff hasn't shown huge differences. Concussion is an interesting field to work in at this point because there's so much fear around it. People can make a lot of money by selling a product that supposedly changes the rate of concussion. And, the way marketing is sometimes done, statements can be kind of misleading if you don't kind of know what you're looking for about the product's efficacy. And so parents and people will invest in these things because they think this is going to protect my kid. And
they think they're doing the right thing, and then So I think there's a lot of that going on in the sport. So there's recently a study that just got done by, she actually is a fighter as well, but then she has I don't know how many PhDs. It's ridiculous, from Cambridge. She's a highly intelligent person. So she did a research study recently on the strength of the neck, and that based on your likelihood to get a concussion. So I'd be super interested. I started to read that, and I think it was I'm probably going to misquote it, but it was something like 1 pound of strength can decrease that up to, she found, 15%. Your thoughts on neck strength and concussion, or if you have any ideas on that?
Yeah, so that's because women have slightly higher rates of concussions than men in sports where we play equally. So soccer is an example. And that's one of the hypotheses as to why that is that women tend to have weaker necks than men do, which makes sense. I mean, another I don't know, thing, I guess, that supports that is lots of times if people can brace for an impact, they won't get as severe. They either won't get a concussion or it won't be as severe as when they get blindsided.
Sure.
And again, if you can engage those muscles, your head is not going to bobble the same way it is if you get blindsided. So it would make sense that a stronger neck is going to stabilize your head, and your head's just not going to bounce around as much. So. And if we think of those, all of those wires, the white matter shearing as the brain sort of sloshes around in the skull, the less that happens, the better off things are going to be. So,
yeah.
Awesome.
So I guess preventative measures, things like that somebody might be able to do. Is there outside of staying out of a lot of those sports, is there much that people can do to be preventative in that realm, or?
So one of the things that we talk about in soccer, so European soccer actually doesn't head nearly as much as American soccer does because they have such good foot skills. So it's actually, they have better ball control if they bring the ball down to the ground and use their feet as opposed to head it. And so there's been some talk of we need to change American soccer to decrease the amount of heading. And there isn't actually a huge number of concussions specifically from headers. Lots of times it's two people that go up for a header and they bonk heads, and that's how they get the concussion. But so there may be some things within the game. I know football in general is working really hard on changing tackling, and they feel like changing tackling has decreased rates of concussion. As far as on an individual level, not much that I can think of.
Not much. Yeah, and it seems like the concussion side of things is, like you said before, it's kind of scary for some folks, but then it's gotten a lot more a lot more press lately. It seems like, I know that NFL had the concussion movie that came out with Will Smith here not too long ago, and I think awareness is starting to become more and more prevalent with that. So, is that something that you've seen as well? Just the rate in that, I guess, I don't want to call it knowledge, but almost awareness go up.
Yeah, absolutely. We still have a ways. There's still more work to be done as far as the education piece. But no, it's vastly different now than it was even a few years ago. So.
Sure. One thing that both kind of scares me and it's just kind of odd to me. It's both on the sports psychology thing and the concussions, is that a lot of times you'll see these athletes not want to report a concussion because they need to I need to get this many tackles or this many touchdowns, things like that, in both in sports or I should say in sports in general, and that seems to be like a psychology thing of, okay, I need to meet this, and now the demands are a lot higher to be, if I want to go to that pro level or whatever, in order to hit that. Any thoughts on how we might be able to change some of that stuff so that it's not so I'm not going to be penalized for having something like that happen?
Yeah. I think some of that comes back to the education piece, but changing the culture around sport and injury in general. We've come a long ways, but there's still a lot of work to do. I think that's one of the reasons why education to coaches is getting pushed. Every state at this point has some sort of legislation regarding high school concussions. A lot of states also within that legislation have the requirement of education provided to coaches, because lots of times that stems with the coach. So if it's an environment where it is acceptable to say, hey, something's off, I need to be looked at, then that's what happens, as opposed to somebody who is worried about getting mocked or losing their place on the team or being called out, whatever, if they say, I think I'm hurt.
Right.
Continuing to push that education, I think, is important. There's some, and this is early research, so it needs to be replicated, it needs to be shown in other settings, but there's actually some research coming out that suggests that athletes who delay reporting end up taking longer to get fully cleared to go back into their sport, which is, something that I talk with athletes about. You actually may be doing yourself a favor to more quickly say something, get, looked at on the sideline. Then if you don't have a concussion, you can always go back in.
Right.
And if you do have a concussion, we can start the management process right away, as opposed to 3 days down the road after you've been through a couple extra practices, maybe gotten hit again, and have extended your recovery time even further than it needs to be.
Right.
But no, we definitely have a ways to go.
And that it's for the longest time, I think the reason I bring it up on the psychology side is, I think especially in the male side of things, we're so usually in sports male dominant. So if you're if I have to take that time off, that's me being not manly or whatever. And so that it's weird that I think that, I definitely think that has to change, but sometimes I think early on in sports, that's what we're taught, is that, okay, that, being able to still perform underneath all that stuff is quote unquote more manly. And that's a big change, I think, where it's those two should be completely separate. So
yeah.
So I just went off on that train of thought, and then now I'm lost on the next one. But so the concussions, another thing that I've heard is, okay, if I have one concussion, I'm more susceptible to getting another concussion. Obviously, that makes sense for directly right after getting one. So is that true, false?
So there's a period of vulnerability. The research suggests that athletes that are well managed and are fully recovered before they go back into play are at no increased risk. So if they get a second injury, it acts as two separate injuries. Okay. Whereas if they get a second injury while they're still in that period of vulnerability, then it's a compounding effect, where that second one might be more severe. The symptoms might last longer. But for athletes who are fully recovered before they go back, it seems that there is not an increased risk for getting a second concussion.
Oh, okay.
Now, once you're up into the multiple, then it sort of becomes a different story. But
Sure. Yeah, but I was actually going to lead into my next question. Is I've heard from like female soccer. I knew one of the girls that had, I think she was at 8 concussions, in high school, and so that's, she chose to give up sports, which was something that she loved, but that was, I didn't know if there was maybe it's the way she plays, or maybe I didn't know if it was okay, now she's more susceptible to that, or maybe she didn't catch it early on, things like that. But yeah, I would hope that that's not very common. So
that's a lot of concussions.
I can think in I've been doing this sport, which I would consider a fairly rough sport, for the last 18 years. And I can think of 2. I had one, about a year and a half ago. And so, which was made into a very nice highlight video, by the way, so thank you for that. That doesn't stick in my head at all. But yeah, that's, and honestly, that was one that I didn't really know at the time, because, I sat there and it happened and competed the rest of the day on pretty much autopilot. And that was, and then we drove back from Chicago, and it was like 8 hours of driving. And the biggest thing, it was all at night, but the biggest thing for me was those headlights that were coming forward were just absolutely killing me. And so that was, a lot of times I've been doing it for, like I said, 18 years, and probably couldn't have told you in the initial stage that I did. Yeah. So, I guess what I'm trying to get at is there any big factors that an athlete should know that, like, hey, I might have a concussion?
Yeah. Well, and I think it's, your comment was, I did it on autopilot. And so sometimes athletes' awareness can be really, really helpful for diagnosing this.
Sure.
If people if you catch yourself and you're like, okay, I'm doing my thing that I'm supposed to be doing to compete,
but I'm not cognitive.
But I'm missing things, or or I'm realizing I'm losing gaps of time. Some of that almost can be. That's worth following up on and
Sure.
saying, I think something, because you're right. Sometimes people don't have sort of those classic concussion. I've got a headache, I've got light sensitivity, I'm throwing up, I'm really dizzy. Sometimes that doesn't show up, especially if you're in the middle of a competition, and some of those things sort of may be normal things that you
Right.
experience in the context of your sport.
Sure.
So.
Yeah. I'd like to think of I know this is probably completely incorrect, but my brain's so small and my head's so big that there's, even if it swells, I still don't think there's going to be any issues there. So I never get headaches. I've maybe had like 5 headaches in my entire life. So,
Yes.
But, all right. So, other things that you think the general public should know about concussions, and some of the studies. I know that we talked a little bit about the Stanford study that they're having our fighters go through. So that's I'm pretty excited about that. I'm much like you. I'm really excited to see some of the results that come out of that.
Right.
Both for our gym, and so I can be a better coach that way, and make sure that I'm not putting our athletes into any additional harm's way. So
yeah. So I think we talked about education. I think part of the important educational piece is that this is an important injury, and it's one that needs to be managed just like any other injury. But there's a lot of really scary, inaccurate information out there. So helping people know, okay, here's what we expect after a concussion. You're not going to feel good for a couple of days, but you're going to get better. Like, the brain fully recovers after a concussion, at least to the best of our knowledge. And there's plenty of things that we don't know about concussion. It's a really hard injury to study because it happens on like the microcellular level.
Right. And like you said, a lot of times you can't see it on imaging or
Right.
anything like that. So.
Right. But to the best of our knowledge, people get 100% better from this concussion. Or from this injury. And so, I talk with patients who think, well, this is going to take me 6 months to recover from, or I'm going to be like this for the rest of my life. And I feel like one of the most important things that I can do is tell them no, because expectation drives outcome. So if the expectation is that you're not going to get better, it makes a lot of sense that you wouldn't get better.
Right.
So I think adding good education about what outcomes actually look like, because for most people, it's really uncomfortable for a little bit, but then you're going to get better. You'll get back to normal. You'll be able to, walk and not walk, talk, excuse me.
Yeah. If we're going to walking, that's rough.
Sorry.
No.
Talk and think and do all of the things that you used to be able to do with no more difficulty than you could before did before your concussion. And I think the other important thing, you commented on the MMA study, and I think sometimes people read these studies and they think, oh, well, this applies to my 12-year-old kiddo who is doing, a martial arts as a recreational sport. There's a big difference between your guys who are doing MMA and have for multiple years, kind of like there's a big difference between those NFL players and the kiddos that are playing at a lower level of competition with smaller competitors for a shorter amount of time. So we need to be careful to not generalize things that we're finding in our elite athletes down to the rest of us, because frankly, most of us are not elite athletes. And so if for no other reason, we haven't had the same exposures that they have. So I think the research with the elite athletes is really important, but it doesn't always tell us much about our everyday people who are playing sports in their high schools or for recreation. So.
Yeah. For those of you, and I think I can talk about this, but for those of you that don't know, Stanford's currently doing a study with some of our athletes, and so essentially they'll do a baseline test before they go and have a fight, and then a test directly after they have a fight, like a day or two after they have a fight, and then I believe 1 month after as well, and just to see if there's any changes, things like that. And so it's I'm super excited about it. They'll come in here and they're doing all sorts of crazy testing, running around, doing some tests with, okay, how fast can you track these numbers, things like that. It's been really cool. So actually, speaking of that, and maybe you can speak to this as well, some of the brain training stuff that you'll see out there, do you see any validity in some of that stuff, like the I'm trying to think of some of the apps right now, but yeah, I saw a big uptick in that in sports for a while. And then from things I've read, maybe that's not quite as working quite the way that they thought. I know that there was some, I think one of the companies got sued just because their claim. Yeah, exactly. Where claims were not quite as correct as they may have said. Yes. So.
Again, at this point, a lot of the research has been done by the companies who put out those products.
Sure.
So there's some bias, potential bias. At this point, what the research suggests is that people get better at the games, but that doesn't always generalize to real life. So, a tracking game or something, you might get faster doing that on the computer, but that may not make any difference with how you are visually scanning or tracking when you're, say, out driving. It's not something I recommend to my patients, but if they come in and they tell me they're doing that, I'm not I don't tell them.
Yeah, stop, don't do that anymore. Yeah,
right.
Okay.
So, and maybe the research will prove greater efficacy in the future, but at this point, it's pretty equivocal.
So. Okay. I think that's most of it as far as what I had. The producer guy, Robel Tesfaldi, you have any questions? We got a bunch of sports psychology questions, which leads me to believe that I was completely on the wrong track, but the concussion stuff is also super important. So,
well, and we can talk about sports psychology. It's just
I guess we'll talk a little bit about sports psychology. For me, sports psychology is starting to the more I think about it, the more or I should say, sports is really dealing with anxiety and how do I say this? Trying to perform a task while under heavy amounts of anxiety and just different levels of anxiety depending on, okay, I have that fear of looking bad in front of others, or maybe I have low self-worth, things like that. So first of all, I guess what the sports psychology things, what got you super interested in that?
Honestly, probably selfishly because I played sports and
And
you know, I
just want-
experienced
yeah.
some of those things. I ran cross country my junior year of high school, loved practices, and hated competitions because I would get so nervous beforehand. So my senior year, I decided to be like the student manager. So I did the practices and I didn't have to run.
Right.
And so, you know, several years later, as I'm older and sort of thinking through things, I'm like, wow, that was a really, I mean, it was high school cross country. So it was a perfectly appropriate way to handle it. But I thought, you know, what if I was actually good at that? And there was some pressure from other outside sources, like you need to like run.
Yeah.
And I don't know how I would have handled that. So anyways, as I got into it, I was like, this is really interesting. And I like the sort of holistic approach, which I feel like is kind of where sport is moving. You know, I was listening to ESPN on the way here and they were talking about some of the changes in basketball, how they're really focusing, increasing focus on like nutrition, and like alternate, like stretching and yoga and some of those things that in the past was not a part.
Yeah, completely. Yeah, like foreign, and most people would say no, don't do that stuff.
Yeah, and a couple of NBA players have come out and have talked about their own mental health issues and some of the ways that they've chosen to deal with it. Things like mindfulness meditation, which not all that long ago was sort of the hokey, fruity. You know, that's what people sit in the corner and like, oh,
right.
And now we've got professional athletes talking about how they use this not only to manage their anxiety off the court, but they feel like it has really positive effects on their play as well, which is really exciting. You know, this holistic, like you're not just an athlete, so we're just going to focus on your physicality, but we're also going to talk about, you know, your emotions, your brain, how that all plays. So.
Yeah, I think that's really cool, and you're 100% correct in the sporting field. For us, that's something that, 5 years ago, 6 years ago was, okay, you don't talk about that stuff. You just bottle that up and never, ever, ever talk about that stuff. And now, especially with our athletes too, it's, like you said earlier, I'm starting to become well-read in that, I think, and I'm probably just enough to be dangerous. And that was one thing that was really surprising to me is when I started talking to the athletes about that, all the athletes were super responsive to that. But I think as a coach, I was ill prepared to receive some of those things. So I was super excited about that, and then immediately got some of that information. I was like, okay, I don't know how to respond to that. So continuing to kind of learn in some of that. And so we have a couple questions here, and first one is calming nerves before match. The thoughts on some of that. And so I'll give my thoughts and then how about you give your thoughts? So for me, initially when I first started, or when I was going for a while, I would compete all over the country. And so what's funny is I actually usually ended up, to calm my nerves, I usually ended up helping out with the event. So I would talk to the event coordinator and say, okay, let me try to not think about this. And so I would help out with the event coordinator and either referee, or I would help bracket, things like that, in order to get some of that away. Now I'm kind of finding out that maybe that isn't the best way. Was trying to trick myself rather than trying to actually alleviate some of those nerves and things like that. But your thoughts on that?
So I feel like that's really individualized to the athlete.
Sure.
So sometimes it's thinking through like what's driving that. Is it a fear of failure? If you go home and you haven't won or performed your best, is your dad going to like,
right.
Is there things that we need to change the way you're thinking about your performance, where failure is the end of the world? So that may be one thing. Sometimes people experience the physical emotion or the physical symptoms of anxiety and they freak out. And so it's talking about, what's happening is actually your body preparing to perform.
Right.
And so changing the way you think about these physical sensations of your heart beating fast, or you're sweating, or you're breathing hard. And as opposed to thinking like, oh my God, I'm dying, you think, oh, look at my body go. Like we're getting ready,
Yeah, that this is probably going to be too much information, but for any of you that have competed with me, I have to use the bathroom about 3 or 4 times before I compete. Never, whether it was first year in or 18 years in, I've won a world championship, but I will, at a lower level, I'll say that. But But yeah, going to the bathroom every single time. And one of the sports psychologists that I worked with said that exact same thing. You know, okay, that's not you getting nervous and something to feel bad about. Your body is basically getting rid of that, so you don't have to. You know, that's you're going to be lighter, you're going to be faster, things like that. And so that was a huge mind shift in me to do that. You know, thinking about that, nothing's changed since then, but now I'm like, okay, that makes sense that my body's trying to do that. It's trying to get ready. It's a special day. And so that my body almost is excited about that, or the butterflies that it feels is, you know, it's exciting. So, next one, any books that you would recommend, both for the, like the, you know, concussion side, neurological side, and sports psychology side? Anything in particular?
So I would say there's really good stuff out there and really bad stuff out there.
Okay.
As far as the concussion stuff, if parents are asking me for references, or I get an athlete who says I want to know more, like the CDC has really good information on what a concussion is, what recovery looks like. It's got good documentation to work with, like schools, about getting back to play. There are some really good blogs on Facebook that I actually follow for the sports psychology side.
Okay.
The AASP is the acronym. American Academy of Sports Psychology, maybe? I should know what that stands for, but it's AASP. And so that's a national organization for sports psychologists.
Okay.
And they lots of times will post really interesting articles or commentary. So I end up getting a lot of that off of Facebook as opposed to a book.
Sure. So. Yeah, as long as it's, I suppose, from vetted sources rather than
absolutely.
Just, let's see. Why is it so hard for me to stay calm in bad situations during training and not in competition? Man, if it's that one would be tough, I suppose. If I'm reading that correctly, you're not staying calm in training, but you are staying calm in competition. That's usually the flip-flop the other way. So I would be interested to see what your training atmosphere is like, if that's something that maybe you're going out and competing without your coach, and that's something that, for me, that's a big impact. When I didn't have a coach, I would go out there and absolutely kill it most of the time. When I did have a coach watching me, I would absolutely shut down. And so maybe it's a flip-flop for you in that way, but I don't know, your thoughts.
Lots of times when athletes are competing, we talk about flow, where they get in this place where it's just, you kind of turn off the thinking part of your brain and you're just like doing, your body knows what it's supposed to do and it just does it. So it makes me wonder if like this person is able to sort of get into flow in competition and do what they're supposed to, but in practice, maybe there's other things they're more aware of, criticisms or things when they're not doing it right. And so they're getting sort of thrown off by mistakes where when they're competing, they just kind of roll. And I guess that would sort of be my first thought.
Sure. Another caveat to that, on the books that I've read on flow, it seems like, okay, I want to get into that peak state of, it's tough for me, but not unattainable, things like that. For me, I almost get irritated sometimes with that idea where it's like, okay, try to get into flow, where it seems like it almost happens rather than something that you can manufacture. Would you agree with that for the most part? And that's the annoying part with me is that, you read these books and you're like, okay, how am I going to get into this? And I think there's definitely a recipe for it, but it's often pretty difficult. So, and it's fleeting as well.
Yes. And I think it really is dependent upon your ability to sort of turn off the thinking part of your brain, if you will, so which is an anxiety thing, right? Because if you're racing and you're thinking about everything and analyzing in the moment, you're never going to get into flow.
Yeah. Right.
Where if you can trust your training and relax to the point where you can kind of turn off all your like internal commentary, lots of times that's when flow just happens.
Yeah. So you're trying to get into that. I think there was one book that I read that's like System 1 or System 2 or like exactly the thinking brain or the basically just kind of almost, I want to call it muscle memory, but I know that that's incorrect. I mean, it's not most people would see it as muscle memory, but it's really just your brain basically.
Yeah, sort of your doing brain
right.
almost.
So yeah. I think another one I'd heard was like the, almost like your professor and your chimp brain kind of thing. So
yeah. Yes.
Well, I think that is most of them. I know that there's, like I said, a lot of interest in this stuff. If somebody, I guess, I'll say this, people that can reach out to you as far as stuff like that, I guess that about the only time that would probably happen is if they were to have a concussion, correct? Or
yeah.
Okay.
Yeah.
So go to Sanford then. That's so. And then you know, if you be in good care with her. So, well, I'd like to thank you today for coming on and talking with me. Like I said, it was super interesting. I'm always interested in this stuff. The sport on our end has changed so much in the last 5 years. I can remember 10 to 5 years ago it was, okay, let's go out there, punch each other, as hard as we can in the face, and whoever's left standing after that is the person that's going to go out there and fight. And that we've always kind of thought that was incorrect, but I think it was a little bit of that ego and also just being completely unaware of some of that stuff. So it's good to see some of this stuff finally change to where now most athletes, I think, are doing this stuff. So thank you very much, and thank you for a solid 45 minutes of your day.
Yes, of course.
As dawn